Evaluating the accuracy and economic value of a new test in the absence of a perfect reference test. I will present a Bayesian meta-analysis model to adjust imperfect references and the economic modeling. This presentation is based on our publication in Research Synthesis Methods. Firstly, we need to understand the consequences of evaluating a new test in the absence of a gold standard. Assuming that the reference standard is perfect will lead to biased estimates of the sensitivity and specificity of the new test. If the test being evaluated has higher sensitivity and specificity than the reference test, and the standard test is naively assumed to be a perfect reference, then the additional patients correctly classified by the new test would be erroneously treated as false positive and false negative. I will introduce the concepts of conditional dependence. When one subject receives two imperfect tests, the test results may not be independent. For example, if a patient has a positive or negative test result in one test, the likelihood of having the same test result in another test may be increased. Ignoring conditional dependence between tests would exaggerate the incremental value of the new test. The conditional dependence between tests can be modeled by the unmeasured or unobserved covariances, conditional on disease status. There are two commonly used models, HSROC model and bivariate model. When not including the study-level covariates, mathematically two models are equivalent. They are different parameterizations of the same model. The bivariate model allows the inclusion of covariates that affect sensitivity or specificity or both, while the HSROC model allows covariates that affect accuracy or threshold parameters, or both. Dendukuri and colleagues extended the HSROC model and developed a Bayesian latent class meta-analysis model in the absence of a perfect reference test. This model can adjust the imperfect reference tests and the conditional dependence between tests. In addition to estimating the sensitivity and specificity of the test under evaluation, these models can also be used to obtain estimates of the sensitivity and specificity of the reference tests, the magnitude of conditional dependence, and the true disease prevalence. This slide presents the conditional probabilities of two diagnostic test results within groups by true disease status, incorporating the conditional dependence. The values of 0 for the covariance indicate conditional independence, which is a special case of conditional dependence. Previously, researchers used WinBugs and OpenBugs software for the latent class meta-analyses model. The OpenBugs code of a working example can be found in the appendix of our publication. More recently, Dendukuri and her team developed an R-Shiny app. This app is user-friendly, and users can run various analyses online. Also, Dendukuri and Schiller have introduced the latent class model and the app. The video is available on YouTube. Please visit this workshop for guidance. Deviance Information Criterion, DIC, is generally used criteria to select the model for the Bayesian analysis. However, face validity is also very important. This slide presents the upper bounds of conditional dependence for sensitivities and specificities. Theoretically, the lower bounds of COVS and COVC are negative values. A negative COVS means that a person with a positive result in test 1 has a decreased likelihood of a positive result in test 2. A negative COVS and COVC do not often occur in clinical practice, so we can assume the lower bounds are 0 in the economic modeling. When the sensitivities and specificities are high, the conditional dependence would be minimal. The Bayesian latent class meta-analysis model can quantify the magnitude of conditional dependence. Then, researchers can directly use these results in economic modeling. However, The conditional dependence between tests may be unknown in some cases. I would like to provide an example of using arbitrary conditional dependence. The economic model in a nice HTA included several tests. The authors estimated the strength of conditional dependence between the two tests based on experts' opinions, and included these in the modeling. In another publication, we provided further discussions of developing economic models of multiple diagnostic tests. Here is the timeline of this publication. Thank you.